Welcome back, CoI'Q listeners. On today's show, I'm doing a solo episode with Matt Johnson, who is the executive producer for our show, and he also has his own podcast in his own right.
Hmm?
Thanks, Matt, for joining me today.
I'm super pumped as always. I love talking through strategy and I love the conversations that we have. So I'm excited to get into it. We're going to talk a little bit about what it takes to actually have an innovation reach commercial success, which of course is what all of your clients and the people that you work with want. It's what we all want. We want to create things that take off and hit the market and people are receptive and they buy it and it takes off. So you've got some things we're going to lay out. We talk about desirability, viability, and feasibility. So we'll give people a little overview of what that is. But what essentially is the problem, right? So why are we talking about this whole thing about innovation and making sure it actually gets commercial success?
So I think the problem that a lot of health innovators face today is that they believe that just because they develop a healthcare innovation that solves a real problem or is functionally superior to other solutions on the market, that's going to be a definite success, and it really isn't the case. And so today we can talk about what are some of those things that they need to be mindful of, because just solving a problem doesn't automatically equal market success.
Yeah, and it's really hard to accept. But yeah, the other side of the equation that these are real people. There's other solutions that probably solve a similar problem or close enough. And yeah, there's cost of switching. There's mental cost of just understanding what your solution is. Like it maybe takes some mental effort to even understand what you're selling. Obviously, you want to lower that barrier as much as possible. But yeah, unfortunately, developing something that's superior to what else is out there, that's our opinion, right? We're the ones that are coming up with the solution. That's our opinion anyway. We have to get people to agree with us. So in other words, a lot of things have to go right in order for whatever we have created, whatever innovation we're creating to actually take off. So let's start with desirability. How do you look at that when you look at whether something you've created is desirable to the market?
Yeah. So I think in healthcare, it's a really unique environment. And so there's some additional factors, right? So first off, you have to know, like, what are the priorities for the folks that you want to sell this to? Because, just because you're solving a problem doesn't mean that it's going to be the priority that health system is looking to solve for the next 3 to 5 years. So that can be a huge barrier. When it comes to desirability, is this real? Do I really have a market that wants to buy this solution? And are they looking to solve this problem right now? Is it something that's keeping them up at night? If it is, then they're likely to buy your solution. If it's something like, it's a problem, but it's really not something that we're looking to solve today or even tomorrow, then you probably need to go back to the drawing board and keep trying.
How do you determine, like for individual health systems, who do you turn to or how do you ask them to get a sense of what their priorities are? I mean, let's say you feel like you have something that you think applies to the demographics and the trends that are going on in their system and their, the people that they serve. They may not agree. How do you figure out what their priorities are and how to find the health systems that maybe do have priorities that match up?
Yeah. So, I think that's really where that needs analysis comes into play, and being able to do research and getting real user and buyer feedback early in that process. So, a lot of times as health innovators, we go into this process and business building with a lot of assumptions and biases. And so getting, making the investment in doing that needs assessment, conducting that research, that primary research where you're asking you're asking those target customers, what are their priorities? And then you're kind of taking all of that data, that real data that you've collected, and kind of grouping it together in the themes and kind of seeing what's popping up, what's bubbling up. And that kind of helps you make those decisions to really validate whether there's the desirability there or not.
Yeah, that makes total sense. And I'm sure it's very, very tempting to skip that because if we're the ones that are developing the solution, we see the problem every day. It's the thing that we're thinking about all the time. It's hard for us sometimes to relate to somebody who doesn't see the problem as clearly and bright and vivid as we do, because it's all we think about. We're the ones that are developing the innovation for it. So that makes sense. So desirability.
And you're not looking for the entire market. to express this need and to have this in priority. So, one of the things that we do is really help the innovators focus on the early adopter strategy.
Yeah.
And so really you're just looking for a small subset of the market in the beginning to kind of raise their hand, do something that kind of indicates that they would be viable buyers. They have this viable need going forward.
Yeah, that makes sense. That's another area, it's super easy to overlook is who are those early adopters? Because we all want the mainstream success. We all want to do something that impacts a lot of people. And it's very, very tempting to skip that step and go straight to the mass and see what they want. And the problem is they don't always know what they want. And sometimes they're the ones that are slowest to adopt a new idea. And we end up skipping over the early adopters for some reason. So,
Yeah,
all right.
yeah.
So desirability. Now let's talk about viability. What do you mean by viability?
So viability. So just because, let's say that you validate that there's the desirability, you've identified that there is a market. Well, just because there's a market for a solution doesn't mean that it's going to be viable for the business, right?
Gotcha.
Are we going to be able to generate enough sales and revenue from this solution? Are we going to be able to price it appropriately, with enough margins to actually build a business around?
Mm.
Is this business opportunity real, and is it worth it?
I love that. It's I was just reading a book by Richard Koch, the author of the 80/20 principle. It was in one of his other books, and he said that the best quote ever. It was number one, is there a gap in the market? And number two, is there a market in the gap? Like,
Yes,
damn you,
yes,
Richard Koch.
exactly.
Yeah,
Yeah, you have
brilliant.
to evaluate the competitive landscape and identify where they fall short. And so there's kind of this belief that I need to be first to market in order to be successful. But one of the advantages that being a fast follower or a second to market is being able to observe where those gaps are in the market, and be able to see how the target audience is reacting to that first to market company and solution, and then be able to fill in those gaps where they fell short. So it can actually end up being a real advantage. And I think in healthcare, it's especially challenging to identify who's paying for it, right? So again, I might have a market for it, I might have a great product idea, and it seems like a no-brainer, right? Of course we're going to identify. I mean, I'm a smart entrepreneur, I'm building a business. More than likely this isn't the first company that I've built. But it's something that really I think gets often overlooked in healthcare because it's a multi-sided market. So often I see that we might kind of mix who the user is with who the buyer is, and then
Oh yeah.
making sure that those reimbursement models are aligned. A lot of times I'll see health innovators say that they're going to circumvent the traditional healthcare system because of all the obstacles and barriers that are built into it, and they're going to go direct to consumer. And the reality is that's really a tough route. Consumers are not willing to pay for a lot of these healthcare things. It's just been ingrained in us for decades that we expect those to be covered by our health insurance, and we're not paying out of pocket for it. It's a
Yeah.
huge behavior change and paradigm shift. So B2C is going to be the easy win, like a lot of people think. And so really being able to identify who's paying for it is going to be important to the viability of the business.
Interesting. Yeah, I'd be very curious. Maybe we'll have to do an episode on this sometime if you have some strong opinions. But I'd be very interested to know what you think of LASIK and other direct-to-consumer type of services and how they took off, and maybe some of the things that they did well and didn't.
Absolutely.
But let's talk about feasibility. You talked about kind of analyzing kind of the landscape. Now, feasibility, you're talking more about like the competitive environment. You mentioned being a fast follower. How do you look at that and determine whether you're too late? If fast follower is an advantage, if you can do something different, like how do you look at that in terms of feasibility?
Yeah. So if you are, so if you're first to market, then you're typically absorbing a huge chunk of the costs of bringing that to market. So
Yeah.
you can't leverage, economies of scale because it's new and it's innovative. And so being a fast follower allows you that. So part of this, feasibility is scanning the landscape, understanding who the players are. Like we had just talked about, examining that and seeing where that gap in the market is and how you fit in. Is there a space for you to play? And most of the time, sometimes I'll work with with, companies, and they want to go in with the cheaper price. And, that's not going to be a winning strategy for an innovation,
Yeah.
right? So we're trying to figure out what is the resources and capabilities that the company needs to build in order to have that competitive advantage and that differentiation. And that kind of validates that it's going to be feasible for them to be able to bring this healthcare innovation to market.
Yeah, I was talking with another podcast host, and who provides a service. He's an entrepreneur in his own right. We're talking about that a little bit, and one of the things that came out of that conversation was just it's a good question to ask yourself. If I had to double my price, whether it's
Mm-hmm.
a service or whether it's a product, would people still buy it? And if that's an automatic no, because everything rests on the only competitive advantage is the fact that you're offering at a lower price, then you've got an issue. You got to find something else. It's just a good mental exercise to think about what would happen if I doubled my prices. Would people still get the value out of it? Would they still buy the product or service? So I love that. It's all about doing something different. And so we've got desirability, we've got
Mm-hmm.
viability, and feasibility. That's a lot of things that have to go right.
Yes, it is a lot. And so that, if you can validate these three factors, that allows you to kind of confirm your product solution fit. It also allows you to confirm your product market fit.
Mhm.
And it's really when you're able to accomplish those two things that you are moving towards commercial success. So those things are not something that's like static, that happens at a single moment in time. It's something that is iterative over a process. And
Mhm.
so you want to be able to, accomplish these two things of product solution fit and product market fit to validate that you've got a viable strategy, commercialization strategy, and business model that you can scale and reach
Yeah.
commercial success with.
Love it. Yeah. And we'll have to do another episode, I think, about just the iterative process. Cause yeah, it's, and a great line, a great way to put it might be just the great strategy doesn't happen in a vacuum.
Right.
There's no amount of navel gazing or, like strategy's hard mental thought, but it doesn't take place in a vacuum separated from the people who will buy it, the people who pay for it, the people who benefit from it. The faster we can get them involved, the better. Speaking of that, you're actually doing a workshop that the listeners might be able to still attend, but I would love for them to know about it at the very least, because you're doing a whole workshop on co-creation, co-product creation. Where can people learn more about that and how to get to that particular event?
Great question, Matt. So the Connected Health Conference happens in Boston in October. I think the dates are like the 16th to the 18th or something.
Mhm.
And so I'm going to be leading a patient co-creation workshop. We'll talk about the hows, the whys, the whats of patient co-creation. And I'll be doing that with one of my colleagues, David Goldsmith from We Go Health. And so people can find out more information about that on the Connected Health website. Love to
Awesome.
have folks join us.
Yeah, and we'll throw a link to that in the show notes so people can get straight there and double check the dates and all that stuff. So nothing has to be exact. So they can check that out and make travel plans and stuff. But besides listening to CoI'Q, getting it on Apple Podcasts and Spotify and Stitcher and all those fun places, where else would you like to send people for them to learn more and kind of dive into a little bit of the strategy behind commercialization of innovation?
So they can go to our website, legacy-dna.com. We've got tons of resources and information there. And then that's the other place where they can look at, case studies, white papers, and then all of our podcast and video shows.
Awesome. Very good.
Awesome.
Well, Roxie, thanks so much. I appreciate it.
Thank you, Matt. Appreciate it. Bye-bye.